Hello everyone, I'm Dr. Sanjana from SIAHMSR Wellness, and today let's discuss about the clinical significance of vitamin D. Vitamin D is commonly known as sunshine vitamin. It's known as sunshine vitamin because our skin can produce vitamin D from the skin fat in the presence of sunlight. The UV rays of sun can convert 7-dehydroxycholesterol of our epidermal skin into vitamin D3. So, this vitamin is known as sunshine vitamin. Before going into the details of the clinical significance of vitamin D or its health benefits, let's have a glance at the history of vitamin D. As I told you earlier, vitamin D is a vitamin obtained from sunshine mostly. Although dietary sources are there, vitamin D is known since ancient times. People from prehistoric era might have known about the good effects of sunlight. They might not be aware about vitamin D, but they might be thinking about the health benefits they get or the refreshment they get on exposure to sunlight. The history of vitamin D begins from the father of history, Herodotus. We know that Herodotus is known as the father of history, and that name or sobriquet is conferred on him by the famous Cicero, a great orator of Roman Empire. Herodotus was a historian of great acumen. He was famous for his meticulous observation on minute details related to history and ethnography, related to the geographical history, etc. So Herodotus was a distinct historian of his time, and the relationship between vitamin D and a historian is really curious. Because of this analytical mind of Herodotus, he started observing the skeleton in the war field. Herodotus lived in a Greco-Persian colony, and at that time his birthplace was under the domain of Persian Empire. Persian Empire was constantly in war with Greece and Egypt. Once there was a great war between Egypt and Persian Empire, and Herodotus was witness to these wars constantly happening in his region, and he reached the war zone as a historian, and he had the habit of examining the skeleton. While examining the skeleton of Persian soldiers and Egyptian soldiers, he found a distinctive difference in the strength of skulls. Egyptian skulls, the skulls of Egyptian soldiers were very strong, and it was difficult to break them even with a stone. But Persian soldiers' skulls were very fragile. It was easy to break. So he started thinking about this difference. What made the skull of Egyptians very strong? He made a meticulous inquiry, and he met many Egyptians, and he inquired about their lifestyle. He studied the lifestyle of Persians also. From all these research data, he arrived at a conclusion that Egyptians had the habit of exposing their skull, their head to sunlight mostly. It was a ritual, or it was part of their tradition, and instead the Persians always wore a turban on their head, and they wore long clothes. The Middle East people always wore long clothes and wore a turban over their head. So the chances of exposing their body to sunlight was very rare. That was the difference. Thus Herodotus understood the importance of sunlight in human life and in maintaining health, especially bone health. So the story of vitamin D begins in BC 450 with Herodotus. Later, in the 17th century, there was another milestone discovery regarding the importance of rickets and sunlight. A physicist, Francis Glisson, found that rickets was common in those people or those children who were residing constantly inside home because of winters and constant rainy seasons. That was another milestone in the discovery of vitamin D and its relationship with bone health. So that is the history of early discovery of vitamin D and its relationship with bone health. But now scientific world is researching on vitamin D in an advanced manner, and the scientific world has found out many curious facts. More than the curious facts, we can say that all these facts are very much important or clinically significant in relation to human health. Let me speak a few words about the sources of vitamin D. Natural sources of vitamin D apart from the sunlight is the food sources, dairy products, egg yolk, fish, cod liver oil, oysters. All these contain vitamin D. From this, we can conclude that animal sources of food are rich sources of vitamin D. So the chances of pure vegans being deficient of vitamin D is very high. So please take care about it, the need of vitamin D supplements or being exposed to sunlight at least. So the dietary requirements of vitamin D daily, we call it RDA. The recommended dietary allowance of vitamin D is 600 international units. But the most notable or noteworthy fact is that the dietary requirement of vitamin D increases with old age in the aging population. It is 800 international units in aging population. Why? That question is very much significant. Why? The reason is bones become more weak or fragile with aging due to depletion of estrogen hormone in females, and in men also there is a decrease in testosterone hormone, and many other age related factors are there. But more than that, there is another factor. The skin 7-dehydroxy cholesterol decreases with old age, and that leads to decreased production or formation of vitamin D. So old age is very risky in relation to vitamin D deficiency. We must conclude like that, because the calcium mineral as well as vitamin D are very important for bone health. calcium and vitamin D are very much important for bone health. If deficiency of any of this happens, there is risk for fracture, age-related osteoporotic fractures. That is the first and foremost significance of vitamin D, and the next one is more important than that. That is the role of vitamin D in managing cancer. It's a recent research finding, and the outcome is very optimistic because sunshine is freely available to all of us, and if sunshine can make a miracle in our life, that should be utilized by the entire mankind to prevent cancer, because the new research states that, or points out that, exposure to sun in mild or medium amount, at least for 15 minutes a day, enhances your vitamin D level. Vitamin D level, if enhanced, it can decrease inflammation and make one resistant to infections, and it reduces the constant or chronic inflammation in the body. We know that chronic inflammation is one of the most important cause for cancer, or a risk factor for cancer. So if vitamin D in sufficient amounts or adequate amounts can reduce inflammation, it's really a landmark finding in the history of medical science. So utilize this abundant sunlight to prevent cancer. And more than that, the researchers conclude that vitamin D can reduce cell growth, cancer cell growth. So survival rate of cancer patients is also high if vitamin D levels are kept in the optimum level. Okay, that's about cancer and vitamin D. And the third clinical significance is vitamin D can reduce the impact of cardiovascular diseases on our life. Cardiovascular diseases means heart attack and stroke. So the pathology of these disorders are clot formation. Clot formation leads to these diseases. Arteriosclerosis is the pathology behind stroke and heart attack. Vitamin D can prevent or reduce arteriosclerosis. So it's a significant research finding which can help us to prevent cardiovascular diseases. And the fourth important factor is it can reduce diabetes mellitus, the incidence of diabetes mellitus, type 2 diabetes. And the fifth factor is it can reduce respiratory infections, the incidence of respiratory infections. So it can enhance the immunity of a community. So these are the most important clinical significance of vitamin D, or health benefits of vitamin D in common parlance. And the most important, I forget to say, the effect of vitamin D on neuronal system, especially multiple sclerosis. We know that multiple sclerosis is a grave disease of demyelination of nerves. It causes demyelination of nerves, and it incapacitates a person in moving or doing almost all functions of the body in the long run, because the nerves and the entire nervous system is affected in multiple sclerosis. The recent research states that multiple sclerosis can be prevented in genetically predisposed children by exposure to sunlight. If a family member has multiple sclerosis, it is better to expose the children to sunlight at least for 15 to 20 minutes a day. Research states that sunlight exposure can reduce multiple sclerosis or prevent multiple sclerosis. It is also used as a therapy in the management of multiple sclerosis. Also, further research or extended research is needed in this regard. And that's all about the health benefits of vitamin D. Okay, and before concluding this session, I would like to speak a few words about the hypervitaminosis by using vitamin supplements. We can get vitamin D from natural sources, from sunlight, as well as from vitamin D supplements. We can use vitamin D supplements, of course. Especially the risk groups should use vitamin D supplements if they reside only indoors, or if they belong to a region or geographical region or where the major weather is winter, or they are constantly exposed only to winter or rainy season. There is no sunlight. In such a case, they should focus on their diet. Vitamin D rich foods should be included in their diet, and they should take vitamin D supplements under the directions of a physician. That I underline, or I emphasize this fact, because vitamin D is stored in our body. Excess intake of vitamin D above 4,000 international units may cause vitamin toxicity. Vitamin toxicity, D toxicity, is a grave condition which may lead to heart attack and stroke. Earlier I said in optimum amount it reduces the impact of arteriosclerosis on our body. It reduces heart attack and the stroke. But hypervitaminosis D causes heart attack and stroke. That's an irony. But we can take precautions. We can take vitamin D only in the necessary amounts, so no problem. Not only vitamin D, many other vitamins like vitamin A and vitamin E in excess doses have detrimental effects on our body. So everything in this universe has a balance. Just like that, take vitamins also only in adequate amount under the directions of a physician. If you take supplements, there is no problem in consuming vitamin D rich foods or exposing to sunlight, and in moderate amounts. I say in moderate amounts, sunlight also, because excessive exposure to sunlight can cause or enhance the risk for skin cancer. And what more? Vitamin D is one of the most important vitamins we should bring into our dietary plan by focusing on dairy product, fish, cod liver oil, butter and oysters, and expose to sunlight at least for 15 minutes a day. And here I recommend one thing. Often I speak about skin care and skin aging and the use of sunscreens. Using sunscreen on face is okay while you get exposed to sunlight, because you need sunlight exposure on your skin without sunscreen on your extremities, on your hands, on your legs. Do not cover it with sunscreen while you get exposed to sunlight, but you can cover your face with sunscreen, because although vitamin D we get from sunlight, the risk of being exposed to sun's rays, UV rays on sensitive areas like face can cause premature aging, oxidative stress to skin cells, and it can cause damage to the skin. So please be aware of this fact and get exposed to sunlight, covering your face with a sunscreen above SPF 30, while you should not cover your extremities, it means your limbs, with the cloth or sunscreen while you get exposed to sunlight. It's good to have a sun bath early morning or before 4 o'clock, or between 4 and 5 p.m. in the evening. So hope you all understand the significance of vitamin D in your life. Have a nice time. Thank you for watching SIAHMSR Wellness. Please keep in touch with us, and we expect your comments in the comment box, your feedback in the comment box. And on what topic would you like to get information, or of regarding disease or nutrition? Whatever it is, please post in the comment box. Thank you for your support.